kuja devolution.
And public health specialist Professor Joachim Osur has urged the government to actively involve youth and adolescents in policy-making around sexual and reproductive health. Addressing the media earlier today, Professor Osur also advocated for comprehensive sex education to reduce teenage pregnancies and prevent the spread of sexually transmitted infections. According to the Kenya National Bureau of Statistics, major contributors to teen pregnancies and STIs include poverty, limited access to health services, low education levels, and gender-based violence.
We have addressed challenges that affect our fellow students, our fellow friends. We are coming to address the problems that we face. So we've written abstracts and we're going to have these amazing discussions and we're going to ask a lot of questions. We're going to keep everyone accountable. We're going to ask you as the media, what have you done? What have you done? We're going to ask the government. We're going to ask the policy makers, how are we addressing these issues that we as the youth are going through? And we're going to be demanding accountability towards us.
We in most African countries have not embraced sexuality education and institutionalized it. So many countries don't have sexuality education. Young people are not equipped with knowledge to manage their sexuality. So what are they doing? They are getting it from the internet. You cannot control what is in the internet. In fact, we know that the fastest growing industry in the world is pornography because people are accessing internet and phones and they are accessing pornographic materials because there is lack of controlled education.
And hundreds of residents from West Pokot and Trans Nzoia counties have staged demonstrations